Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, here's something that, well, it really makes you think. Women are actually twice as likely as men to develop post-traumatic stress disorder.
Yeah, it's a stark statistic, isn't it? Really significant.
It really is. And that underscores why we need to understand how this condition affects women specifically. So today, we're diving into some really interesting new research.
We are. It looks at a potential way to help women who have post-traumatic stress disorder symptoms and are also, really struggling with sleep.
Which often go hand in hand, right?
Exactly.
Yeah.
And this research explores whether a specific type of exercise, high-intensity interval training, could actually improve their sleep.
And this is important because, as you said, this group hasn't always been the focus.
Precisely. A lot of earlier work, it often overlooked women facing both of these challenges together. So this study really fills a gap.
Okay, so the sources we're looking at today, it's a new paper just published in Sleep Medicine. The researchers are Melissa McGranahan and Patrick O'Connor from the University of Georgia.
Right. And there was also a health news piece covering their findings.
So our mission for you listening is to unpack this study. Could this kind of exercise be a genuinely practical tool for women dealing with these symptoms to finally get some better sleep?
That's the core question. Let's dig into what McGranahan and O'Connor actually set out to do.
What was the main purpose here?
Well, the primary goal was pretty straightforward. Could 6 weeks of high-intensity interval training improve sleep quality, specifically in women who showed signs of probable post-traumatic stress disorder and were already poor sleepers?
Okay, makes sense. Were there other things they looked at too?
Yes, secondary aims. They also wanted to see if the exercise changed things like anxiety levels or that feeling of being constantly on edge, hyperarousal.
Hyperarousal.
Right. And one other thing, heart rate variability. That's a measure related to your nervous system's balance.
Got it. So how did they actually set up the study? Who took part?
It was what's called a pilot randomized controlled trial. Small scale, sort of an initial test. They got 30 women involved.
And these women all had sleep issues and likely post-traumatic stress disorder symptoms.
Correct. They reported sleep problems and scored above a certain level on a standard questionnaire for post-traumatic stress disorder symptoms.
Okay. And then they were split into groups.
Yep, randomly assigned. Half went into the high-intensity interval training group, the exercise group. The other half were a waitlist control group. Basically, they waited to see if they'd get the intervention later.
Right, the standard comparison. And the exercise itself, what did that involve for the group doing the training?
They went into a lab setting 3 times a week, and this went on for 6 weeks.
Okay.
And in the lab, they did their high-intensity intervals on these special stationary bikes, bicycle ergometers.
So the researchers could really track their effort precisely?
Exactly. It allowed them to quantify the power output, making sure the intensity was consistent and measurable, not just, go for a run.
Yeah, much more controlled. So what did they measure along the way over the 6 weeks?
They took measurements right at the start baseline, and then again at weeks 2, 4, and finally at the end, week 6.
And these included?
Things like self-reported sleep quality using a global score from a questionnaire. Also, those post-traumatic stress disorder symptoms, again, anxiety levels, hyperarousal feelings.
And the heart rate variability.
And heart rate variability, yes. Quite a few data points across the study period.
Okay, seems thorough. So after the 6 weeks, crunching the numbers, what did they find? What were the key results?
The results were, pretty striking, actually. A full 60%, 60 of the women in the exercise group reported that their sleep quality got better.
60%, that sounds like a lot.
It is. Many of them actually shifted categories from being rated as poor sleepers to good sleepers based on that questionnaire.
Wow. And what about the control group, the ones on the wait list?
Only 6%, just 6% of them reported any improvement in sleep.
So 60 versus 6, that's a massive difference.
Yeah. It really is. It strongly suggests this relatively short exercise program made a significant impact on perceived sleep quality. Moving from poor to good sleep is a big deal.
Absolutely. A powerful finding right there. Did they see changes in the other areas too, like anxiety?
They did. They also saw what they described as large reductions in self-reported anxiety and those hyperarousal symptoms in the exercise group, especially when compared to the control group.
Okay, so less anxiety, less feeling keyed up.
And better sleep. It seems connected. The study suggests that maybe tackling the anxiety and hyperarousal through the exercise is like a pathway to improving the sleep itself.
That makes a lot of intuitive sense, doesn't it?
Yeah,
If you feel calmer, less vigilant, sleep would likely come easier.
you'd think so.
Now, what about that heart rate variability measure? Did that change explain the sleep improvements?
Well, this is where it gets interesting. They found that no, heart rate variability didn't significantly mediate the sleep improvement.
Meaning it wasn't the mechanism driving the change.
Exactly. It suggests the link between the exercise and better sleep might be more directly tied to those reductions in anxiety and hyperarousal rather than changes in this particular physiological measure, heart rate variability.
Huh. Okay. So stepping back then, what does this all mean? What are the implications here?
Well, I think for women who are dealing with post-traumatic stress disorder symptoms and also really battling poor sleep, this study suggests high-intensity interval training could be a genuinely valuable, practical tool.
Practical because it's time efficient.
Yeah, high-intensity interval training doesn't necessarily require huge blocks of time, and these results showed improvements within just 6 weeks. So it offers a potential non-drug option that might feel, quite accessible.
And it's filling that research gap we talked about earlier.
Definitely. It specifically zooms in on this group women with post-traumatic stress disorder who, as the researchers stressed, have been underrepresented in exercise studies. So it's adding crucial evidence where we didn't have much before.
Could these findings potentially apply more broadly, beyond this specific group?
The researchers think so. They suggest these positive results could really inform future, larger studies. Maybe looking at other groups with post-traumatic stress disorder symptoms, like veterans, for instance.
Right, veterans often face significant sleep issues, nightmares and such, linked to trauma.
Exactly. So the potential is there for broader application, but it starts with studies like this one.
Of course. And like all research, this study has its limits, right? We need to be aware of those.
Absolutely. Always important. First off, it was a pilot study. Small sample size, only 30 women.
So promising, but needs confirmation.
Precisely. We need larger trials, maybe with more diverse groups of women, to really be confident these results hold up more generally.
Okay, and what about how they measured things like sleep and anxiety?
That's another point. It relied mainly on self-reports, what the women said about their sleep, their anxiety, and while that's incredibly valuable information,
It can be subjective.
it can be, yeah, subject to individual perception, maybe bias. Future studies could strengthen this by adding objective measures, things like actigraphy watches that track sleep-wake cycles, or even lab-based sleep studies.
Getting data from multiple angles
Yeah.
makes sense. And the exercise itself, was it very specific?
It was that particular high-intensity protocol on those lab bikes. We don't know for sure from the study if, say, doing high-intensity intervals by running outdoors or swimming or using different equipment would give the same results.
Right, so the specific type of exercise might matter. Lots to explore still.
For sure. But it's a really encouraging start.
Definitely. Let's bring in what the researchers themselves said. Melissa McGranahan, the lead author. What was her take?
She really emphasized her motivation being that underrepresentation of women in this research area. She wanted to contribute to a more inclusive picture of how exercise can help recovery.
Focusing on improving sleep and health for a group often missed.
Exactly. A group often overlooked, as she put it.
A crucial point about making research more equitable. And her co-author, Patrick O'Connor.
He highlighted the practical takeaway, for women who aren't very active, have these post-traumatic stress disorder symptoms, and sleep poorly.
He's saying trying this type of exercise program is likely to help.
Likely to lead to perceived sleep improvement, yes, based on their findings over 6 weeks. And he also brought up the potential relevance for veterans again, particularly those dealing with nightmares and sleep problems tied to trauma.
So the bottom line seems pretty hopeful. This could be an accessible, effective strategy for some people struggling with sleep.
It really does seem that way. A promising non-pharmaceutical route to explore for sleep difficulties linked to post-traumatic stress disorder symptoms.
This has been really fascinating digging into this study. It's quite compelling how a specific exercise approach might offer such benefits. So for you listening, maybe just consider this for a moment. How could incorporating even short bursts of more intense activity affect things? Not just physically, but maybe your mental state, your sleep quality.
Yeah, it's food for thought.
And of course, if you or someone you care about is facing significant sleep issues, especially alongside other challenges, it's always vital to look into evidence-based options. Exercise might be one, but definitely consult with healthcare professionals too.
Absolutely. Essential advice.
This study really does open up an interesting avenue, though. for more research and potentially more support options down the line.
It does. It gives us some solid initial evidence that high-intensity exercise could help improve sleep for women with post-traumatic stress disorder symptoms, possibly by helping to lower that anxiety and hyperarousal.
Well, thank you for joining us on this deep dive into exercise, sleep, and post-traumatic stress disorder symptoms in women. We really hope you found this exploration useful.
And hopefully it sparks some thought about the connections between movement, mind, and rest.
Thanks for tuning in to the Health Headliner podcast by To Do Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.